Hi, this is Andrea Alamani with Patient Navigation Team, and I want to talk to you about a serious topic today. It gets me a little fired up, so I don't want to offend anyone, but I also want you to know this is very important. And what I'm talking about are vaccinations, particularly for your children. So what I want to start with is ask you if you've even thought about why we're actually having outbreaks of chickenpox and measles in the United States. Certain populations, particularly children, are exposed to the virus, and if they're not protected by a vaccination, they are going to most likely get the chickenpox or the measles. So the question to you as parents is, do you understand fully the purpose of the vaccine? So what the vaccine does is it actually simulates the invasion of that live virus into your body, but it's an inactivated virus. And so you don't actually get the chickenpox or the measles, but you get an immune response as if your body had been exposed to the live virus. So from that point forward, or about 3 weeks after the vaccination, you have antibodies that are prepared to recognize an invading virus of chickenpox or measles, for example. Then, if you are exposed to the live virus, those antibodies can more quickly attack the invading virus. I think we see this with the flu vaccine every year, where they try to determine which strains we will be exposed to and provide a vaccination for those. So basically, getting that vaccine doesn't 100% protect you, but what it does do is hopefully prevent you from getting the flu. And if you do get flu-like symptoms, it won't be as prolonged as if you had not had the vaccine at all. So that's the real objective, and that's an example that we see every single year. So one thing that we hear, and I think this is probably what's happening in Asheville, North Carolina, for example, is this is all concentrated primarily at one school. And so what can happen in a case like that is parents can incorrectly rely on something called herd immunity. And looking at the CDC website, that's going to tell you what that means is that you're not vaccinating your child. You're relying on everyone else to have vaccinated their child. So by proxy, your child will not be exposed to that particular illness. So when that doesn't happen, if you're in an environment where multiple children are not vaccinated and they are exposed to chickenpox or measles, which are both highly contagious viruses, they are going to get it, and they are going to then pass it along to their friends that have not been vaccinated either. So this is something that's very important for you to understand, is the definition of herd immunity and how it does work and how it does not work. So I know that many of you are going to be very concerned about the risks of having a vaccination, and I think this is something that you should seriously discuss with your healthcare professional and let them help you understand those risks. So according to information on the CDC website, your chances of having an adverse effect from a vaccination are less than 1 in 1 million, while your chances of being in a car accident are 139 in 1 million. So you're driving your child all over your county is a lot more risky than getting them vaccinated for chickenpox, for example. So please consider that. That's the kind of thing you need to discuss with your healthcare provider. In addition to discussing this with your healthcare provider, do your own research. Don't rely on information you're told in the carpool pickup line at school, or on TV necessarily, or on the web. Go out and do your own research and look at the National Institutes of Health and the CDC, and then any other organizations that you want to look at as well. Whenever I'm looking at an illness or a vaccination or a vitamin supplement, I will look at multiple sources, because one source may not always tell you the complete story, and you want to understand it. So sometimes a perspective from one place is more clear to you than another. But I do advise that you look at the CDC and the National Institutes of Health as well for all of those. They're very valuable resources, and they have easy to read and printable PDFs for you. So lots of information out there at all different educational levels. We've been very fortunate in this country that we have eradicated polio in the country through vaccinations, but many of the people in the country that are now having children aren't aware of such things. Many of you probably were vaccinated for chickenpox and never even saw your friends get sick from that. So you really, other than the flu vaccine, you really don't see these kind of illnesses take place because they're already addressed in our vaccination schedule. I think it's important to really take a look at the history of these viruses and the impact they had on people before the vaccinations versus now. And so for me, for example, I just attended the 70th anniversary of a community hospital in my hometown, and it housed polio victims, and many of them were, actually most of them were the age of 5 or lower. Many of those kids ended up in an iron lung, and most of those kids were in there for 10 months to a year. They were hospitalized, they were immobilized so that they would not damage their muscles in any way. Very serious, and it's something that, you know, I can only relate to by seeing pictures, and fortunately I know people that experience that. But it's important to remember those things and not take those vaccinations for granted. So I think that polio is a near and dear virus to me because I am in Rotary International. And when we look at polio victims around the world, we understand the crippling impact of that virus and how fortunate we are to have the ability to vaccinate our whole population. And additionally, how fortunate we are to have Rotarians that are willing to go into other countries, and they are putting their own health and in some cases their own personal safety at risk to vaccinate children in countries such as Pakistan. So when we have people risking their own safety to go to countries to help those people and keep them from getting polio, I find it very concerning that our first world issue is to discuss whether we should take a vaccine or not. And so just remember, whenever you're thinking about whether to vaccinate your child or not, that an outbreak of measles or chickenpox or, God forbid, polio is really just a plane ride away. Think about that because that is something that is so important and can impact our whole population. So I hope that this video has made you think and hopefully given you, maybe it's upset you a little bit, and that's okay. But what I want you to do is really be fired up about finding out more about vaccinations, talking to your physician, looking at the CDC website, and forming your own educated opinion. This is Andrea Alamani with Patient Navigation Team. If you feel that you would like to discuss some of this information about vaccinations or other topics with me, please feel free to give me a call. Thank you so much.